In this lecture, we'll be discussing about chronic dacrocystitis. Now, beginning with the definition, dacrocystitis, it refers to the inflammation of the lacrimal sac. Now, the etiology, it involves a vicious cycle of stasis and mild infection of long duration. Okay, so again, remember stasis and mild infection of long duration. Now, the predisposing factors are age, 40 to 60 years. It is more common in females due to the narrow lumen of the bony canal compared to that of males. The other predisposing factors are heredity, race, socioeconomic status, and poor personal hygiene. Now, remember, we mentioned that it is a vicious cycle of stasis and mild infection, that is stasis of the tears. Now, let us look at the factors responsible for the stasis of tears within the lacrimal sac. Now, the first is anatomical factors, that is narrow bony canal, partial canalization of the membranous nasolacrimal duct, or excessive membranous folds within the nasolacrimal duct. Second is the presence of foreign bodies in the sac. Third is excessive lacrimation leading to stagnation of tears. Fourth is the mild inflammation of the lacrimal sac due to associated recurrent conjunctivitis, which may block the nasolacrimal duct by epithelial debris or mucus plugs. And finally, obstruction of the lower end of nasolacrimal duct by nasal diseases like polyps, hypertrophied inferior concha, DNS, etc. So again, remember the factors responsible for stasis of tears within the lacrimal sac. Now, this can be remembered due to either excessive lacrimation leading to stagnation of the tears, or it may be due to blockage within the lacrimal sac, and this blockage may be due to foreign bodies or epithelial debris and mucus plugs due to mild inflammation of the lacrimal sac. Then it may also be due to partial canalization of the membranous nasolacrimal duct or excessive membranous folds within the nasolacrimal duct. And finally, it can also be due to the obstruction of lower end of the nasolacrimal duct by nasal diseases like polyps, hypertrophied inferior concha, and DNS, or it can be also due to the narrow bony canal as seen in females. So these are these factors responsible for stasis of tears within the lacrimal sac. So again, anatomical factors, remember three things: narrow bony canal, partial canalization of the membranous nasolacrimal duct, excessive membranous folds within the nasolacrimal duct. Second is foreign bodies. Third is excessive lacrimation. Fourth is mild inflammation of the lacrimal sac, which results in blockage by epithelial debris and mucus plugs. And fifth is the obstruction due to nasal diseases. The source of infection is usually it is the infection that spreads from the conjunctiva, nasal cavity, or the paranasal air sinuses. And the causative organisms are staphylococcus, pneumococcus, streptococcus, and pseudomonas. So this is about the etiology of chronic dacrocystitis. Remember, stasis and mild infection of long duration is the etiology. Now, the clinical features of chronic dacrocystitis, it can be divided into 4 stages. The first is the stage of chronic catarrhal dacrocystitis. Second is the stage of lacrimal mucocele. Third is the stage of chronic suppurative dacrocystitis, and fourth is the stage of chronic fibrotic sac. Now, the stage of chronic catarrhal dacrocystitis. Now, catarrhal refers to the inflammation or infection of the superficial mucosa. So, the stage of chronic catarrhal dacrocystitis, it is characterized by mild inflammation of the lacrimal sac and blockage of the nasolacrimal duct. Now, the symptoms are mainly watering from the eye, and on syringing, either clear fluid or mucoid flakes regurgitate. And dacrocystography, it shows a normal sized lacrimal sac with healthy mucosa and a block in the nasolacrimal duct. Okay, so first is stage of chronic catarrhal dacrocystitis. This is the initial stage. So there is blockage of the nasolacrimal duct, and hence there is mild inflammation of the lacrimal sac. Now, this is a basic pathological concept, that if a duct is blocked, then the portion distal to the duct, it will be inflamed. So hence blockage of the nasolacrimal duct leading to mild inflammation of the lacrimal sac. And because that the inflammation is mild, the only symptom is watering from the eye. And on syringing, clear fluid or mucoid flakes regurgitate. And dacrocystography, that is when you look at the lacrimal sac, you can see a normal sized lacrimal sac with healthy mucosa, and there is block in the nasolacrimal duct. So this is the first stage. So remember, block in the nasolacrimal duct plus mild inflammation of the lacrimal sac. Second stage is the stage of lacrimal mucocele. Now here, chronic stagnation of the tears, it causes distension of the lacrimal sac. So we have the nasolacrimal duct which is blocked, and hence there is stagnation of the tears, which leads to distension of the lacrimal sac. Now here the symptoms is constant epiphora, that is constant watering from the eye, and because of the distension of the lacrimal sac, there is a swelling just below the inner canthus of the eye. And on regurgitation, there is milky or gelatinous mucoid fluid oozing out from the lower punctum. Okay, so on regurgitation test, or that is when you apply pressure here, there is oozing out of milky or gelatinous mucoid fluid. And on dacrocystography, a distended sac with blockage in the nasolacrimal duct is observed, and there may be an encysted mucocele. Okay, so this entire structure of the distended lacrimal sac is known as mucocele, and this may be encysted when, that is, if both the puncta are blocked, it is encysted. That is, if you apply pressure, there is no oozing out. That is, regurgitation test is negative for encysted mucocele. That is, opening of both the canaliculi into the sac is blocked, and hence it becomes encysted. So this is the stage of lacrimal mucocele. That is, remember, because of the block, there is chronic stagnation of the tears leading to distension of the sac, and the swelling is watering from the eye plus swelling within the swelling just below the inner canthus of the eye. Regurgitation test, there is milky or gelatinous mucoid fluid oozing out from the lower punctum. Dacrocystography shows distended sac with a blockage in the nasolacrimal duct, and if both the puncta are blocked, it results in an encysted mucocele. So this is the second stage, that is stage of lacrimal mucocele. Now coming to the third stage, which is the stage of chronic suppurative dacrocystitis. Okay, now due to pyogenic infection, the mucoid discharge, it becomes purulent. That is, the mucocele gets converted into a pyocele. Now the symptoms are epiphora and swelling. Along with this, there is recurrent conjunctivitis due to the infection. Okay, so there is swelling at the inner canthus, and because of the infective process, there is also mild erythema of the overlying skin. So the symptoms are epiphora, recurrent conjunctivitis, swelling at the inner canthus of eye, and mild erythema of the overlying skin. Now here, on doing the regurgitation test, there is purulent discharge which flows from the lower punctum, and if both the upper and lower puncta are closed or blocked, it results in an encysted pyocele. So again, the stage of chronic suppurative dacrocystitis, the mucocele, it gets infected, and it results in the formation of a pyocele. The symptoms are epiphora plus swelling, and the two additional symptoms are recurrent conjunctivitis due to the infective process and mild erythema over the skin. Regurgitation test, there is purulent discharge which flows from the lower punctum, and if both the puncta are closed, it results in an encysted pyocele. Now the fourth stage is the stage of chronic fibrotic sac. Now here, because of repeated infections, it finally results in a small fibrotic sac due to thickening of the mucosa. So in the stage of chronic fibrotic sac, remember the etiology, stasis and mild infection of long duration, and because of these repeated infections, it finally results in a small fibrotic sac due to thickening of the mucosa. Now the symptoms are persistent epiphora and discharge, and on dacrocystography, a very small sac with irregular folds of mucosa is seen. So again, the chronic fibrotic sac, repeated infections results in thickening of the mucosa. There is persistent epiphora and discharge, and on dacrocystography, a very small sac with irregular folds of mucosa is seen. So these are the stages of chronic dacrocystitis. So remember, the first stage is the stage of chronic catarrhal dacrocystitis. That is, there is a block here, and there is mild infection, mild inflammation of the lacrimal sac. Symptoms are watering from the eye. Then on dacrocystography, a normal sized lacrimal sac with healthy mucosa and a block in the nasolacrimal duct is seen. The second stage is the stage of lacrimal mucocele, and here, because of the blockage, there is chronic stagnation of the tears leading to distension of the lacrimal sac, and the symptoms are constant epiphora plus swelling just below the inner canthus. And on dacrocystography, a distended sac with blockage in the nasolacrimal duct is seen. And remember, regurgitation test, it results in milky gelatinous mucoid fluid oozing out from the lower punctum. Next is the stage where the mucocele becomes converted into a pyocele due to infection, and hence the symptoms are blockage, constant epiphora. Along with this, because of the infection, there is recurrent conjunctivitis and mild erythema over the skin. And on regurgitation test, purulent discharge is seen. And finally, because of repeated infections, there is thickening of the mucosa. This results in a very small sac, and that stage is known as stage of chronic fibrotic sac. Now coming to the complications of chronic dacrocystitis. Now the first complication is chronic conjunctivitis. That is, remember, there is oozing out of purulent discharge, and this can result in conjunctivitis. So hence the first complication is chronic conjunctivitis. Second is the ectropion of the lower lid, that is the outward folding of the lower lid. Third is the maceration of or eczema of the lower lid skin. Fourth is a corneal ulceration if corneal aberrations become infected. And fifth is endophthalmitis, that is when the entire eye is infected. So again, remember the complications. So first, the oozing out of purulent discharge results in chronic conjunctivitis. Second is that there is ectropion of the lower lid. Then the skin over the lower lid shows maceration or eczema. And finally, the entire and then if the corneal aberrations are present, if they become infected, results in corneal ulcers, and if the entire eye becomes affected, it results in endophthalmitis. So these are the complications of chronic dacrocystitis. Now coming to the treatment. Well, the first is conservative treatment by probing and lacrimal syringing. So to remove the block of the nasolacrimal duct, we do probing and lacrimal syringing. So this is the first treatment, that is conservative treatment. Second is the balloon catheter dilation. Now this is for patients with partial nasolacrimal duct obstruction. So a balloon catheter is inserted and dilated, and this will relieve the blockage in the nasolacrimal duct. So the first two treatment options are probing and lacrimal syringing or balloon catheter dilation. Now the third is dacrocystorhinostomy. Now this is the operation of choice for chronic dacrocystitis. So remember, DCR or dacrocystorhinostomy. Now what this does is it re-establishes lacrimal drainage. So this is the mode of the operation of choice for chronic dacrocystitis, that is dacrocystorhinostomy. And fourth is dacrocystectomy or DCT. Now its indications are important. So this is a commonly asked maybe 1 mark question, or if chronic dacrocystitis is your essay question, this can be asked as a sub question. What are the indications for dacrocystectomy? Now the 4 indications are when the patient is too old. Second is a markedly shrunken and fibrosed sac. Third is the presence of infections like tuberculosis, syphilis, leprosy, or fungal infection of the sac. And fourth is gross nasal diseases like atrophic rhinitis. So DCR is the operation of choice, and it is contraindicated, that is dacrocystectomy is indicated in the following cases, that is number 1, old patient; number 2, markedly shrunken and fibrosed sac; number 3, infections like TB, syphilis, leprosy, and fungal infection; and fourth is gross nasal diseases like atrophic rhinitis. And the fifth mode of treatment is conjunctivodacrocystorhinostomy, that is CDCR, and this is done if the canaliculi of the lacrimal apparatus are also blocked. So again, the treatment: conservative treatment by probing, lacrimal syringing, balloon catheter dilation, DCR, DCT, and CDCR. So these are the treatment options for chronic dacrocystitis. So this concludes our discussion on chronic dacrocystitis. So a quick revision. Now the definition: it is the chronic inflammation of the lacrimal sac. Etiology: it is a vicious cycle of stasis and mild infection. We discussed the predisposing factors, like it is more common in females aged 40 to 60 years. Then the factors responsible for stasis of tears within the lacrimal sac. Now these are anatomical factors like narrow bony canal, partial canalization of the nasolacrimal duct, or excessive membranous folds within the nasolacrimal duct, foreign body within the nasolacrimal duct, excessive lacrimation, then blockage of the nasolacrimal duct by epithelial debris or mucus plugs due to mild inflammation of the lacrimal sac, and finally the obstruction of the lower end of the nasolacrimal duct due to nasal diseases like polyps, hypertrophied inferior concha, and deviated nasal septum. Now the sources of infection can be the conjunctiva, the nasal cavity, or the paranasal air sinuses. Causative organisms are staphylococcus, pneumococcus, streptococcus, and pseudomonas. The clinical stages, we discussed the four stages. The stage of chronic catarrhal dacrocystitis, where there is blockage and mild inflammation of the lacrimal sac. Then we discussed the stage of lacrimal mucocele, where there is stagnation of tears and distension of the lacrimal sac. Then the conversion of mucocele into pyocele due to infection. Then the symptoms are swelling with erythema over the overlying skin. Then recurrent conjunctivitis and epiphora. And finally we discussed, because of chronic the stage of chronic fibrotic sac, that is due to repeated infections, the mucosa becomes thickened, and this results in a small fibrotic sac. So these are the four stages of chronic dacrocystitis. Then we discuss the complications, that is the first is recurrent conjunctivitis, then the ectropion of lower lid, maceration or eczema of the lower lid skin, corneal ulceration and endophthalmitis. Then we discussed the treatment, that is conservative treatment by probing, lacrimal syringing, and balloon catheter dilation, DCR, which is the drug the operation of choice, DCT or dacrocystectomy and its indications we discussed. Remember, patient is too old, markedly shrunken and fibrous sac, TB, syphilis, leprosy, fungal infection, and gross nasal diseases like atrophic rhinitis. And finally, if the canalicular are also involved, we do CDCR, that is chronic conjunctivo dacrocystorhinostomy.